Dr. Fred Kusumoto. He is a professor of medicine and cardiology. He is the head of heart rhythm services at Mayo Clinic, Florida. He is the current president of the Florida American College of Cardiology Division, and he is also soon to be president of the Heart Rhythm Society. He has 2 lectures for us, one on atrial fibrillation, risk factors, and rate control, and then recognizing common arrhythmias. Dr. Kusumoto.
Great, thanks, Thomas. I really appreciate it. And you know, Thomas and Michael have put together this phenomenal conference. I mean, it really is quite remarkable. I've been doing this now every other year. I get the lovely invitation. I'm always excited when I get that email. And they really have put together this incredibly relevant conference. So I have no disclosures, and I love the way that they organize these talks, right? Because what they do is, you know, maybe not. So in the way that they design these talks, it's always cardiology first. I wake up at 5 in the morning to kind of get here. And in particularly, it's the arrhythmias first, right? The electrophysiologist. So my task today is then to talk about this first 25 minutes, atrial fibrillation. And atrial fibrillation really is, you know, when you think about it, sort of the low back pain of cardiology. And the reason is, again, having a hard time with there we go. Let's see here, the low back pain of cardiology, because, you know, it's really a chronic problem. It's really, really difficult to treat. So what we're going to do here today is really talk about atrial fibrillation. And when I got the title of this talk, it was Risk Factors and Rate Control. So what does that really mean? When you think about that specifically, what it means is, for risk factors, can we prevent atrial fibrillation? I mean, that's the question, is for risk factors for atrial fibrillation. And with regards to rate control, you know, so when should I decide to do rate control and how should I do it? Or more critically, you know, when should I refer this patient of mine who has atrial fibrillation for rhythm control to one of the cardiologists? So let's go with risk factors. Can we prevent atrial fibrillation? So there are going to be some modifiable risk factors that we're going to talk about. There is a genetic predisposition. So if you have someone who has a sort of a sister or a brother or a mother or a father who has atrial fibrillation, that patient is likely about 2 to 3 times the risk for atrial fibrillation. Now remember, that number is pretty small when you think about absolute and relative risks. If, let's say, the likelihood of developing atrial fibrillation is about 2%, 3%, then if you have a first-degree relative, then that increases up to about 6 to 9%. But generally, the absolute risk would still be low. But when you think about modifiable risk factors, we think about weight, we think about fitness.